I'm Dr. Steve Laffey. I'm a board-certified pediatrician and pediatric emergency medicine physician. I am the clinical director of the emergency department at SSM Health Cardinal Glennon Children's Hospital, and I'm an associate professor of pediatrics at St. Louis University School of Medicine. We see whatever comes in the door, anything from minor illnesses, coughs and colds, to major traumas and critically ill kids. We're a level 1 trauma center here at Cardinal Glennon, so we see the sickest of the sick and the most seriously injured. But a lot of our time is spent with much more minor illnesses and injuries. We don't have a relationship with our patients in general, so you have to work and try and build that in a very short amount of time and under circumstances that can be very challenging. So I think the things that work for me, getting down on their level, talking to them as kids, understanding how their brains work and how they think about things, and trying to maybe see things through their eyes a little bit. And I think the more experience you have with that, the better you get at communicating with them on a level that they can understand. You have to be honest. They can pick out, the bluffing very, very quickly. They don't want to be lied to. They don't want to be told something and have something else happen. So you have to be honest with them. But again, I think the challenge in the ER is trying to build a rapport with them in a very limited amount of time. If you can get a little smile out of any of them, then I think and sometimes you can't. Sometimes it's a real challenge, but if you can get a little smile out of them, that'll often get them on your side. It helps to be familiar with, what's going on in the kids' worlds. You have to keep a little bit of an idea of what they're into and what's on TV and that kind of stuff. But I think, again, a little smile goes a long way. When you're at a place like Cardinal Glennon, there's a feeling here. There's an atmosphere here that I think is not found even in every children's hospital. There's a closeness, there's a camaraderie that we have, and I think the patients can sense that. They sense how well the doctors and nurses get along. They sense how well the physicians communicate. I think that feeling that we have naturally projects to the families and the patients that are here. And I think that's what they love about coming here too. I think they feel that there's a specialness to this place that when you walk in, you start talking to people, I think you just naturally feel it.